We have a great question from a community member, which what are the treatments available for somebody who's had a stroke, whether that's a hemorrhagic stroke or an ischemic stroke. An ischemic stroke is when you have a blockage of a blood vessel that stops the blood flow and the oxygen from getting to a certain part of the brain. And a hemorrhagic stroke is when a blood vessel ruptures and you bleed either into the brain or around the brain. And the most important thing to know about those types of stroke is that they can be treated and that time is brain. And that means dialing 911 because only certain treatments are available within a certain time frame. It's also important for you to know that the #1 treatment for stroke is not to have a stroke in the first place. And the best way to do that is to control your risk factors for stroke. And the biggest ones are hypertension, diabetes, obesity, and smoking.
The community member asked the question, why are so many young people having stroke? The answer to that is simple. Anyone can have a stroke. The symptoms for stroke occur in older and younger people. We're starting to see more younger people present with chronic diseases such as diabetes and hypertension due to the increased obesity rate in this country. So that is something we have to work on. Also, we're starting to see more people present with strokes in large arteries due to the COVID-19 infection. But the key message is to call 911 immediately if you're experiencing the sudden onset of weakness, difficulty seeing out of one eye or the other, headache, any of those things. Call 911 immediately. We also have an acronym called FAST, the sudden onset of facial weakness, arm weakness, or speech problem. If that happens, then the time is important. Call 911.
A community member has asked, can babies and children have a stroke? Yes. About 25 in 100,000 newborns and 12 in 100,000 children have a stroke. In newborns, often happens before the baby is even born and can manifest with weakness on one side of the body that makes the baby left-handed or right-handed at a much earlier age than ordinarily would be the case. The signs are very much the same as they are in adults. Weakness on one side of the body, difficulty finding words or speaking, difficulty walking. Stroke can occur in children who have COVID-19 because of an inflammatory syndrome that children can develop with that illness. But stroke at any age is an emergency. Call 911. Act fast.
We have a great question from a community member, which is, can COVID-19 cause a stroke? Well, we don't know yet. There's a lot of research that needs to be done to understand the links between COVID and stroke, and the NIH is investing heavily in trying to understand that. But one thing that we do know is that the number of people coming in with stroke symptoms has reduced substantially since the beginning of the pandemic. That means that people that are having strokes are either not coming in or they're coming in too late. And the #1 thing who's having a stroke is dial 911 and get in as quickly as possible. Some of those treatments cannot be given after a certain amount of time. We don't know whether COVID has a link to more blood clots. We're investing in a lot of research to understand that, but so far we don't have an answer.